Ovarian reserve. What is reserve? It means the capacity of the ovary to produce eggs. How do you measure the reserve? You do calculate or you do measure a hormone called anti-Ovarian hormone. The normal value is 3 to 3.5. If the reserve is very low, then the capacity to produce eggs is low, and this is an urgent situation which you have to handle. A low reserve is seen generally in women over the age of 35. At 37, the reserve becomes 50%. At 38, it's only 30%. At 40, it's only 10%. And at 42, it's only 5%. So after 35, there is a steep drop in the ovarian reserve. In terms of figures, a value of 2 means that you have to really speed up with your treatment. No more gaps in treatment. Continuously, you have to take treatment in the form of natural with follicular study or intrauterine insemination. But if the value is 1.5, then this is an alert or an action. Alert is 2, action is 1.5. That means you have to act. If you've never had IUIs earlier, do an intrauterine insemination a couple of times if your age is less than 35 and your reserve is 1.5. But if your age is over 35, 37, don't even give yourself that chance to do an IUI. Go directly for IVF. If the reserve is 1, then you're in a really bad shape and you have to take urgent treatment, preferably as IVF. But if the family objects, which happens quite often, not going directly for IVF, then, or rather, they don't want you to go directly for IVF, then at least try a couple of IUIs continuously and then make a decision about IVF as early as possible. If the value is 0.5, then you're in a really dangerous situation. You have to try only IVF as early as possible. Now, at this point, it's very important to tell you how to improve the reserve of the ovaries. You can take medication, lifestyle modification, yoga, acupuncture. Try to improve the reserve. You can't achieve anything great, but at least even 5%, 6% or 10% will help you. Now, the other end of the spectrum is the high ovarian reserve, more than 3, that is about 6, 7, sometimes 10, and sometimes even 12. Now, these are the patients who belong to a particular category, the patients with polycystic ovaries. So this is another group where as the AMH gets higher and higher, it becomes more and more difficult for them to produce eggs, either during when you try to stimulate the ovaries for a natural cycle with a follicular study, or in an intrauterine insemination cycle, or an IVF cycle. So you have to use higher doses of medication to make them produce eggs. So it's very important to treat these people as early as possible, because the longer you wait, the worse the situation is. So AMH is very, very important, and the sister of AMH is doing an antral follicle count, which we identify with the ultrasound. You do an ultrasound on day 3 of the cycle in the resting phase of the ovaries, and the normal value is about 12, max 15. But if it is very high, sometimes you find even 50, then that is anything more than 15 or 20 is polycystic ovaries. But if the value is very low, less than 5 or less than 6, then you call it a poor ovarian reserve. So what is normal? Anything between 6 to 15 is normal. So AMH and antral follicle count are used to identify the ovarian reserve. And today, with a lot of young patients having low reserve, it's very, very important to look at these values and identify how effectively your ovaries are functioning.